Well, good morning, everyone. How are you all doing? It's nice to see you all, especially all the students, bright and early on a Sunday morning. This must be required. On behalf of the School of Religion, the Office of Religious Life, and the Institute for Integrative Health, it gives me great pleasure to welcome you all to the University of Southern California for the second day of our special conference this weekend focused on wellness through the prism of yoga and meditation. It's something I can appreciate these days with a 5-month-old at home. I haven't slept in a few weeks, and I now fully appreciate the central role wellness plays in our lives. I'd like to give a special thank you to my co-chairs for this conference, especially to Rita Sharma for her heroic efforts in putting this conference together and for her enormous contributions to the School of Religion. So thank you to Rita. I believe a conference like this is entirely appropriate to be hosted right here at USC because the Indian legacy of pluralism and reconciliation, of spiritual contemplation and critical thinking really plays out on our campus every day. As many of you know, here at USC we have more students from India and more Hindu students than any other American university. We have one of the only dedicated Hindu prayer spaces on campus in the United States. And each year our Indian students hold large Diwali, Holi, and Ganesh Puja events that are open to the entire student body. We had over 300 students at Ganesh Puja just 2 weeks ago. Our students raise the Indian flag at the center of campus for Independence Day and Republic Day. They host screenings of popular Bollywood films, complete with chai and samosa at intermission. They compete together on USC's cricket team, which was ranked number 6 in the nation last year. And they regularly meet and interact with prominent Indians visiting USC. Recent guests on campus have included luminaries such as His Holiness the 14th Dalai Lama of Tibet, Sri Sri Ravi Shankar, President Abdul Kalam, Amir Khan, Deepak Chopra, Vandana Shiva, Girish Karnad, Vidhu Vinod Chopra, Shashi Tharoor, and USC trustee Ratan Tata. And on a campus that boasts more student religious groups and campus religious chaplains than any other American university, USC has a vibrant presence of student dharma groups, including 5 Hindu student groups, 4 Buddhist student groups, a Sikh student association, and a Jain student organization. USC is also unique in its curricular offerings through the School of Religion, where James McHugh and Rita Sharma teach courses focused on Hinduism, and Lori Meeks and Duncan Williams teach courses focused on Buddhism. Next year, the School of Religion will launch a new Ph.D. program, which will have a track focusing on Asian religions. With our proposed partnership with the Dharma Civilization Foundation to endow the first ever community chair in Hindu studies in American history, right here at USC, under the name the Swami Vivekananda Chair of Hindu Studies, we believe that we can be a national leader in Dharma studies. In many ways, with a strong School of Religion and Office of Religious Life, USC can help illuminate what the scholar-practitioner paradigm looks like in this day and age. And we're grateful to have an incredible role model and mentor right here in Los Angeles, a scholar-practitioner who has mentored a generation of young scholars in religious studies, including me. It gives me great pleasure today to introduce you to my friend and colleague, Dr. Christopher Chapple. Dr. Chapple is the Naveen and Pratima Doshi Professor of Indic and Comparative Theology at Loyola Marymount University. He received his undergraduate degree in Comparative Literature and Religious Studies from the State University of New York at Stony Brook, and his doctorate in the History of Religions through the Theology Department at Fordham University. He served as Assistant Director of the Institute for Advanced Studies of World Religions and taught Sanskrit, Hinduism, Jainism, and Buddhism for 5 years at the State University of New York at Stony Brook, before joining the faculty at LMU, which has a much better view and much better weather. It's a good move. It's the Pure Land. He co-founded LMU's program in Asian and Pacific Studies, chaired the Department of Theological Studies for 5 years, and served as Associate Academic Vice President for 4 years. In 2002, he established the Yoga Philosophy Certificate Program through LMU's Center for Religion and Spirituality. He is now the director of the Master of Arts in Yoga Studies program, which is really unique in the American higher education landscape, and I think a model for so many of us. His research interests have focused on the renouncer religious traditions of India, yoga, Jainism, and Buddhism. He will give a keynote talk along with Lori Fazzo, entitled "The Sources of Yoga Therapy and Its Relevance to Mind-Body Wellness." And now it gives me great pleasure to introduce you to Lori Fazzo. She holds a B.S. in Physical Therapy from Boston University, an advanced master's degree in Manipulative Therapy from the University of South Australia, and she received her doctorate from the Massachusetts General Institute of Health Professions. She's on the faculty at Mount St. Mary's College Doctoral Program of Physical Therapy and has appeared on Good Morning America. In 2000, she began her teacher training journey with Dr. Matthew Taylor and received her certification in 2007 from Samatha International with Larry Payne. She has also studied with Swami Veda from the Himalayan Institute and describes her personal practice as a combination of Hatha and Kundalini practices. Interested in the scientific applications of yoga practices on health, she was the lead investigator with Dr. Ellen Langer at Harvard University in a randomized control study entitled "Effects of Mindfulness on Memory and Function in Chronic Pain Sufferers." In 2011, she presented her work in neuroplasticity, neuroplastic yoga for chronic pain at the Symposium for Yoga Therapy and Research. Lori has been teaching in Yoga Therapy RX since 2008 and is the Associate and Clinical Director of the Level 4, where she mentors students in an interdisciplinary chronic pain program at the Simsman Venice Family Clinic. She is also the founder and owner of Mosaic Physical Therapy in Los Angeles. Please join me in welcoming Christopher and Lori to USC. Thank you.
Thank you, Varun, and thank you particularly the students. It's early Sunday morning, and I'm so happy to see that you were able to get yourself here, and also some good friends from the West Side as well. So I wanted to primarily tell just a little bit of a story about therapeutics from a personal perspective before I hand this over to the true professional in this area. And I, myself, started yoga as a teenager, and I've been what we might call a dedicated practitioner for 45 years. And when I was in high school, I went through the standard in the old days. Everybody got a visit with the doctor, and the doctor sort of contacted my parents and said, "We think your son needs to be put in a brace." And my parents asked me, "Do you hurt?" And I said, "Oh, no, I don't hurt." And I just sort of started yoga, and over really decades of dedicated practice, what could have been a debilitating scoliosis is pretty much disappeared from this body, and I owe this really to yoga. And in experimenting with that psychic, emotional, physical body connection, what I discovered along that journey is that the body houses, through the connective tissue, lifetimes of memories. And that through steady, sustained attention, all of those things, those sticky things, can come into a place of both recognition and release. So I just want to say that yoga, for me, is something deeply, deeply personal. The other shout-out that I really have to give, which should be more like a humble, quiet namaste, is to the woman who I met when I was 18, who welcomed me into an ashram that she had just established in 1972. And for 12 years, went there with a girlfriend. We were shortly thereafter husband and wife, and we still continue in that glorious role. And for 12 years, we were really embedded in deep tapas. And Purushotama has visited the ashram, and it included the expectation of vegetarianism, of the systematic application of the yamas and the niyamas, ahimsa, satya, steya, brahmacharya, parigraha, shaucha, santosha, tapas, svadhyaya, ishvara, pranidhana, as well as weekly fasting and weekly silence. So with this tapas, of course, all of those processes of purification become escalated. And then after a rather remarkable life change that Varun just mentioned, I just decided I was ready and applied all over the country, and blessedly the tenure track position I landed is 17 minutes from here. Well, I guess 20 by the time you get to LMU, but I live a little bit this direction. But I've been at Loyola Marymount ever since. And historically, of course, yoga was first introduced, and we have the expert on this, Phil Goldberg, here in the 1880s. Actually a little bit before with the Transcendentalists. And then we have the arrival of Swami Vivekananda. We have the arrival of Paramahamsa Yogananda. We have the backlash against in the 1920s. Then we have the resurgence in the 1960s with the change in civil rights law. My guru was one of the golden 10,000, the first crop of Indians that were allowed to migrate to the United States. And then we have the backlash of the 1980s, where there was that wonderful song, I'm sure even the young people know it, "Not into Yoga." Remember that line from the, I guess it's a Jimmy Buffett song. And our ashram was actually infiltrated by Lord knows who, the CIA or the FBI or whatever. It was actually quite comical. But then when I moved out here and I visited sort of the ossified remnants of yoga in the Vedanta Society and the Yogananda Society, I really felt the energy of what our teacher had put together. And then all of a sudden in the 1990s, yoga came back. And we convened a study group at my home with people from the Vedanta Society and the Shivananda Society and disciples of Guru Mai and people that still had their primary affiliation to Muktananda and to Bikram, Chowdhury, and just all of the different paths. And I went to my dean in the late 90s and I said, you know, there's this really energetic interest in yoga. Let's start a master's degree. And they looked at me like I was from Mars. But they said, oh, but we like you anyway, so just start a little certificate. So we started a little certificate, and about 8 years into it, they said, wow, you have enrolled hundreds, thousands of people in these certificates. We had awarded an array of certificates. Lori will talk about the therapeutic one. And then they invited me to actually go forward with the proposal. And those of you who blissfully are unaware of the underbelly of academia, there are endless processes of the department, the college, the university, with committees that just poke and prod and poke and prod, and administrators that say yes, and administrators that say what? They said yes. So it took longer than, actually shorter than I anticipated, but eventually it happened. And we enrolled our first class in the Master of Arts in Yoga Studies a little more than a year ago. We welcomed our second class at the end of August. And we currently have 42 graduate students studying yoga at an academic level with a range of interests, including the therapeutic. And as you will hear from Lori, I see yoga really moving forward. It's really unstoppable at this point. And we're, of course, in the best city for advancing this. And I'm so glad that you'll get to hear a little bit more about what we've been able to do at LMU, as well as hear scientifically about some of the many benefits that yoga provides. So, Lori.
Good morning. Can you hear me here? Yes. So, yes. Oh, does it come up here? There we go. How's that? Okay. I'll try not to talk with my hands too much. So, all of the body is in the mind, but not all of the mind is in the body. This quote from Swami Rama, founder of the Himalayan Institute, and the first yogi to offer himself to be studied by scientific methods. I think this speaks a lot to especially this conference here this weekend. He demonstrated the ability to consciously and voluntarily control his autonomic nervous system. At the time, it was believed that he was able to stop his heart completely. However, we now believe that what actually happened was that he was able to slow his heart rate down and his pulse down to such slow imperceptible by scientific methods to perceive. So he demonstrated also the ability to alter temperature in one limb versus another, and was able to voluntarily produce and maintain different brainwaves upon command. He stressed that he was no magician, and that his motives for such demonstrations were to show medicine that we can have control over so-called involuntary muscles, such as the heart and over the autonomic nervous system. The yogic viewpoint of disease stresses that most disease progresses in phases from psychic to psychosomatic to somatic and then finally organic. A common example is stress and worry from daily life. I'm sure we all know this, resulting in anxiety and fear, which then places the body in a chronic sympathetic state. Over time, hypertension may occur, combined with poor lifestyle management, such as emotional eating and poor diet, ultimately resulting in heart disease, obesity, diabetes, and death. Heart disease, obesity, diabetes. These three lifestyle diseases, as we call them, are so prevalent and the statistics are alarming. Google these three diseases together and you will find a plethora of data all showing what could equate to an epidemic, and the numbers are only rising. Clearly, we don't have the answers yet in medicine, or these numbers would not be rising at such alarming rates. Swami Rama's demonstrations in 1974 may hold the key to solving this mounting problem. How did he accomplish those feats? How did he learn to volitionally control his autonomic nervous system? Yoga. So it's time that we talk seriously about the science of yoga and this new field called yoga therapy. Yoga is thousands of years old, as you know, and yet the field of yoga therapy is relatively new. What is this emerging field of yoga therapy? First, let's make a distinction between yoga and yoga therapy. Yoga is an ancient spiritual science. Despite the glorification of the physical aspects of yoga here in the West, the physical practices are but a small piece of a much bigger puzzle. Yoga therapy, as defined only earlier this year by the International Association of Yoga Therapists, or IAYT, is the process of empowering individuals to progress toward improved health and well-being through the application of the philosophy and the practice of yoga. With so many facets of yoga, each rich in wisdom, one could study over the course of an entire lifetime, as Chris, and still have much to learn. One thing that does not take long to observe is that practicing yogis tend to be very healthy people, healthy of mind and healthy of body, and that many unhealthy people have transformed their health and well-being through their yoga practice. Anecdotal evidence, we could say, to date. Many people living with spinal cord injury, cancer, multiple sclerosis, chronic obstructive pulmonary disease, depression, etc., have improved their quality of life through their yoga practice. Recognizing this, trailblazers in modern medicine began researching these yoga practices, seeking scientific explanations and clinical evidence for these practices. Studies have been done on the effects of yoga on heart disease, cancer, polycystic ovarian cancer, depression, asthma, low back pain, PTSD, post-traumatic stress disorder, insomnia, anxiety, ADD, and many, many more. In the past 10 years, there have been almost 2,000 clinical studies published on yoga. These studies acknowledge that yoga therapy has a place today in today's evidence-based medicine world as a viable tool for health and well-being. Visionaries at Loyola Marymount University foresaw this and 10 years ago launched Yoga Therapy RX, a certificate program Chris was referring to, geared towards melding yoga and modern medicine. Many of our graduates today are working full-time as yoga therapists in medical clinics, hospitals, corporate wellness programs, prisons, and schools. This past year, LMU expanded its yoga therapy programs and commenced a clinical internship in partnership with the Sims Mann Venice Family Clinic. Our yoga therapy interns joined an interdisciplinary medical team consisting of allopathic medicine, Chinese medicine, and chiropractic. They treated chronic pain patients one-on-one with yoga therapy, and the results were outstanding. In the next few years, we hope to publish the data as our part in bridging the ancient science of yoga with modern medicine. One thing that I found incredibly remarkable was that many of the patients who showed up for yoga therapy actually had no idea what it is. That's not surprising, as most people don't know what yoga therapy is, including some of the physicians who referred their patients for yoga therapy. Those who have heard of it typically associate it with merely stretching or relaxation. The patients who were referred for yoga therapy were primarily referred for management of some type of chronic physical pain, for stretching and relaxation, lower back pain, neck pain, knee pain, headaches, etc. What we found was that most of these patients suffered from comorbidities such as hypertension, diabetes, obesity, and depression. Many had been cycling through the system for years without any lasting relief. As yoga therapists, we are more concerned with the patient's quality of life goals than their chief complaint and medical diagnosis. Drawing from the wisdom of yoga philosophy and practices, we prescribed individual programs targeted at empowering the patient to manage their conditions and better navigate day-to-day life. Practices from the Yoga Sutras, such as Pratipaksha Bhavana, or reframing their perspective, Yoga Nidra, guided imagery, visualization or bhavana, meditation, and yes, we included physical asana or the physical poses. The results? Outstanding. One patient whose blood pressure has been in excess of 200/90 for the past year, despite 3 different medications prescribed by her physicians, was able to reduce her blood pressure to 165/80 in the first session, 15 minutes, and 5 weeks later brought in her home blood pressure cuff, searching me down the hallway, asking if I could check it because she thought it was broken. I asked her, "What's wrong?" She said, "It doesn't go over 165, it must be broken." It was incredible. She reported feeling hopeful and said that she now understands the effect that her thoughts have on her heart. I don't know if you've ever seen, Netter has a beautiful picture of the nervous innervation of the heart. And it basically shows a highway of nerves from the brain to the heart. We showed her this picture as a demonstration of how her thoughts can affect her heart. True mind-body awareness. Another patient, a homeless man with a club foot and chronic pain, became free of pain, 0 out of 10 on that pain scale, resumed his cherished hobby of surfing with his club foot, and told us that he found his home on his mat. He was no longer homeless. The stories go on and on. To achieve the level of clinical competency required for such results, these students had years and years of study. To become a yoga therapist, these students had to obtain their 200-hour yoga teacher training certificate. Up until recently, the next step was another 300 hours for a total of 500 hours. Over the past 10 years, yoga therapy training programs have evolved from 500 hours to 800 hours, and now the requisite 1,000-hour training. Recently, the International Association of Yoga Therapists published educational standards for the training of yoga therapists, and just a few months ago announced the first 12 yoga therapy training programs in the world to be accredited, with LMU at the forefront. So where to from here? 1,000 hours, it's really not that much. If we look back at the evolution of the field that I come from, the field of physical therapy, we will see that it mirrors that of yoga therapy. Today, the standard for physical therapy is the entry-level doctoral degree. However, 100 years ago, there was no such thing as physical therapy. Today, over 200 universities in the United States offer advanced doctoral degrees in physical therapy. How did this come about? Economics, supply and demand. In the early 1900s, during World War I, soldiers were returning home from war with spinal cord injuries, amputations, and other disabilities. Walter Reed Hospital developed 300-hour reconstruction aid certificate programs to train professionals in how to rehabilitate these soldiers. The demand for such professionals increased between 1920 to 1930 due to a polio outbreak, which left many Americans struggling with weakness and disability. By the end of the 1940s, polio was no longer an issue due to the advent of the Salk vaccine. However, World War II and the Korean War brought more injured soldiers, and advances in medicine kept injured soldiers alive longer, thus maintaining the demand for rehabilitation and for physical therapists. Similar to yoga therapy, the training programs quickly evolved to 600-hour certificate programs, and 10 years later to the 1,200-hour certificate programs. At the same time, New York University was the first university to offer a bachelor's degree in physical therapy alongside their 9-month certificate program. By the end of the 1940s, the American Physiotherapy Association was formed, and the first master's degree was launched in 1942. Today, the entry-level doctorate is the standard of education for physical therapists. This evolution is almost identical to yoga therapy. 200 or 300-hour trainings doubling to 500 or 600 hours, and then 10 years later to 1,000 or 1,200 hours. Just as NYU offered the first bachelor's degree in physical therapy alongside a certificate program, LMU was the first university in North America to offer a Master of Arts degree in yoga studies alongside its certificate programs. The expansion and the evolution of the field of physical therapy can be related to the demand for such expertise. Extended lifespans, the advent of joint replacements, and the prevalence of chronic back pain created continued demand for this field of physical therapy. Today, we have a new demand, a much bigger demand. Lifestyle diseases are the top 3 causes of death in the United States. Conditions such as diabetes, heart disease, and cancer are on the rise, and my guess is that each of your families has been affected by at least one of these conditions. Heart disease is the #1 cause of death worldwide. These are lifestyle diseases, and yoga therapists are lifestyle management experts. Numerous medical studies have proven that yoga practices can positively impact those with lifestyle diseases, and in some cases reverse the disease process. Last century, our country needed physical rehabilitation experts, and the field of physical therapy was birthed. Today, our country needs lifestyle management experts, and yoga therapists have that expertise. This is no longer an alternative. It is imperative. 100 years ago, polio was prevalent, and today it is rare. Lifestyle diseases are prevalent today, and let's pray that 100 years from now, they will no longer be the top 3 causes of death in this country. Thank you.
Like disease-wise, if it's like heart, like disease or diabetes, would you guys prescribe different types of therapy for them?
That's a great question. I'll kind of have a twofold answer for that. Yes, the, quote, prescription is different depending on the disease. However, it's a little different than the typical Western medical outlook, where it's kind of a, for this you prescribe this, for this you prescribe this. From a yoga standpoint, we really look at the whole picture, and there's a model that we use called the koshas or the mayas, and it basically looks at the physical, the energetic, the thoughts, the spirit, all together, and we look for a commonality, a common thread through those. And then the practices that are given are to address all of those levels. So there may be one practice for one person that actually addresses all, and there might be multiple practices.
Professor Villamoria.
That's probably a nickname. Just following up on that and some discussions that came up yesterday too, and I'm sitting here thinking this, and I'm making some reflections from Australia. When you say prescription, I believe you don't mean the sort of normal prescription that doctors and the GPs do of medical and so on and so forth.
Correct.
Now, also in connection with health, mental disorders as well. I think you might bring in some of the benefits of yoga to that as well, and we discussed that yesterday. But when you see what's happening in the insurance world, the insurance company world, the corporate world, and DSM-5 that's just come up, and it's impacting on Australia and New Zealand and places like that as well. They're affecting a lot more diseases, not so much diseases, but symptoms rather, which makes it even more difficult now to prescribe, quote unquote, complementary medicines and so on. Because for every little fraction of an anxiety and so forth, there's more drugs that are going to be developed by the pharmaceutical companies and so forth. And that's what will cure, quote unquote, you, rather than this whole holistic approach. So what's happening in the medical world is that things are being so atomized in categories and so forth, that the holistic approach just is not going to work. Not going to work, meaning it's not going to be feasible, viable, at least for the pharmaceutical companies to say, well, we won't make our profits and we'll forego all that, and you can go ahead with this. This is the world we're confronting, and this is right now happening in Australia, where this wonderful welfare medical system that we've had, health system, is being totally medicalized, and from medicalization it's been insuranized, if you like, corporatized, basically, really moneyized, or we're using all kinds of terms to try and figure out just what's going on. And of course, the companies that are moving in are American pharmaceutical companies and American insurance companies. That's a kind of a wall that, what Vandana Shiva calls water wars, this might be our health wars.
Yeah, please.
Okay. 50% of the American public actually prefers alternative methods. And there's a little bit of self-sacrifice on the part of people that are dedicated to yoga. And many yoga therapists do fine, and many yoga therapists work at a low pay rate. But I think that the knowledge of self-care, as this knowledge becomes more readily available, and if you look at the Saturday section in the LA Times, the cover is Bhakti Fest and the inside is all about the benefits of mindfulness, that this form of education, I think, is really creating an alternative concept of what it means to be healthy. And yeah, the pharmaceuticals, I stopped watching the evening news because it's geared toward my academic, which is old, and all they do is advertise pills, pills, pills. So yeah, we just have to, it's countercultural, and we need to keep moving forward.
You speak to my biggest fear. Being in physical therapy for almost 30 years and watching it basically degrade because of the confines from the insurance companies. And that's my biggest fear as yoga therapy becomes a respected profession, that it too will become controlled. This is really will require, I believe, a paradigm shift, because it is not money-making in that way. And as you know, it all comes down to the corporate and the money-making. And many yoga therapists are seeking to become reimbursed by insurance companies because they believe that that's the way that they can reach the masses. And I strongly advise against that, because I do believe that that is the beginning of the end of being able to practice in the holistic way that you speak, because they do compartmentalize it. And in yoga therapy, we don't break it down as diabetes. It speaks back to the question over here. Diabetes, hypertension as separate diseases. It's actually all one common thread, and therefore the tools that we use are actually empowering, because when somebody thinks that they have 8 diseases, that's very disempowering. And when they realize that it's actually all coming down to a few simple, common, foundational ways of how they're living their life, they actually have more empowerment to make a change and affect all of those 8 diseases. And the minute that it becomes through insurance and compartmentalized, as you say, I think that could be the end.
She had her hand up.
Thanks. My fear is that it's proven so successful that yoga therapy will be subsumed into the existing licensed professions like PT. My experience at the VA is that the holistic model is very much taking a hold, and other existing licensed professional groups are being taught the techniques.
Yeah, could you explain that, Nancy? Because you have, Nancy Moeller is a yoga therapist at the VA, and I think people would be very interested to hear about your experience there briefly.
Speaking from my experience, only not representing the VA.
Right into the...
I'll try to speak a little louder. My voice is soft, sorry. I speak for myself as a trained yoga teacher and yoga therapist through the LMU program, not speaking for the VA. I started volunteering there years past. It's a great experience. Now they have hired the first yoga teacher inside the medical system as a job position. It's under rec specialist, rec therapy. It's not under yoga therapy, and I'm not called a yoga therapist at the VA because there are quality management MDs who have strong opinions and perspectives about it not being proven therapeutic. We can do 8-week studies, fantastic growing research being published, but we don't have the long-term benefits to show. So that's a little bit of background. I'm happy to talk to anybody during the break about what my experience is at the VA. But my question is, will yoga therapy move toward the license model that you fear getting it inside the system, or will these techniques be part of holistic programs that go into other already existing service areas within the medical establishment?
Big, big questions. And I think we're hearing cautionary tales, but we just don't know what's going to happen.
It was nice to hear that the yoga is coming back, but a couple of words you use which are alarming to me. I'm a physician. I spent 45 years of my life in Massachusetts. From there, when I come here, every street corner has a yoga center, meditation center, massage center, looks so different. The word you used was there is a demand and money situation here. In medicine, we have been worried about cracks and imposters for a long time. Even now we get people who have no training in medicine and start treating people. My question is, since I'm from India, people ask me, can you refer me to a good Swami or meditation place? Just because somebody is wearing an orange color robe, I cannot refer them to them because so many things have happened. How you're watching for that kind of quackery in the yoga teaching and yoga practices? And sometimes I feel that people take a weekend course on meditation and yoga and started teaching from Monday. You mentioned 1,000 hours. But is there any awareness about the quackery in this field or easy money making? I know personally a man, when the bubble burst in 2008, he was an MBA. He and his girlfriend started a meditation and physical therapy session. Both of them have no training.
Yeah, that's why we really, because I've been observing a lot of shenanigans over my 45 years of involvement, and that's what really drove me to want to raise the level of education and to just raise the ethical awareness. And if we look at Mahatma Gandhi, he was deeply, deeply involved with various forms of yoga and did it with great integrity. And I think that as the society is, as Lori so beautifully pointed out and points out to both our graduate students and our certificate students, this interlacing between body and mind, it holds all sorts of implications, and we must hold ourselves to a very high standard. So I heartily endorse your critique.
I agree, and I foresee as the evolution, like as I said, evolution of physical therapy to a doctorate degree, even 1,000 hours is barely enough. As you probably, when we think about what these people are addressing, we're not treating. I think we look at it more as managing and working with a human being who's having an experience of a disease rather than specifically treating a disease. And that's one of the distinctions that I am constantly highlighting for the students, that they don't misinterpret that they are there to treat a disease. And I see that even within well-intentioned people, and which is a bit scary.
We have time for only one more very quick question and answer for about 2 minutes.
Thank you. My question was, when
straight
we are
up.
talking about yoga, how do you define yoga? Because there's so many various kinds of yoga, and I see in the West, when you talk about yoga, all they think about exercises, movements of the body. But does that help? That's the only way, like the yoga should be? Because yoga is a lot deeper than that. So when we're talking about curing the diseases and all that, like if you see Bikram yoga and all that, they're doing saunas and all that, charging so much money. Do you agree with that?
Yeah, Lori opened with that quote about the mind is in the body, but how did the quote go?
All the body is in the mind, but not all the mind is in the body.
And the core definition from Patanjali is Yogacittivritti Nirodha, that yoga is that ability to bring about a state of stillness that not only is in this physical body, which actually we know our body is, we have an electromagnetic body, we have a community body, we have family, all the way out to the universe. And by bringing calm and peace from within and then allowing that to move through the concentric circles, that really is the definition of yoga, as that wellness takes place in that pacification, in that shanti process. And the program that we offer at LMU is a comprehensive program that investigates the philosophies of Buddhism and Jainism and the comparative mystical traditions from throughout the world, including psychological insights from the modern period. And yeah, I've never gone to the place of saying that physical yoga is a bad thing. What I always say is that it's a gateway, and that if people can understand that they breathe in and they breathe out and they move forward and they move backward and they move from side to side, that that's the beginning of the exploration of the body, and that the body is as large as the universe itself. You look so anxious, though.
For hearing problem, because that also relate to the brain and neurological. I see many experts over here researching. So what kind of research has been done, or is any kind of result for the hearing? Right now it is only a surgical method has been produced to us.
I don't know the answer for sure. I know that the closest thing that I'm aware of is the studies on neuroplasticity, basically the changes in the brain that as we age, kind of a degradation, and how meditation, particularly a practice that can have the opposite effect. However, I'm not sure about hearing. I don't know if anybody else is familiar.
Yeah, some of our programs are available online. Yeah.
join me in thanking Professor Christopher Chapple. And Dr. Laurie. The thing is that I'm going to thank each of you individually. What I wanted to say is the work that some of your questions brought up for me very quickly is the concern about the appropriation of yoga, the diminution of yoga, the reductionism of yoga, attenuation of the actual width and breadth of the tradition. But I think that what you're looking at with Professor Chapple's program and the Masters in Yoga Studies that he's developed is a effort, and a very successful effort, to return it to exactly where the roots are, and to essentially positively and affirmatively answer these concerns. And I, as a scholar, as a practitioner, and just as a human being who appreciates the value of this profound tradition, I want to thank Dr. Chapple for his groundbreaking pioneering work. So join me in appreciating him. I want to thank very much Laurie Fazzo. Dr. Fazzo's presentation taught me so much about this connection between physical therapy and yoga therapy and how the way it's moving, particularly what the IAT has recently explained. Is there a conference going on in Lenox right now on it?
Yes, the research conference.
The
Yes,
research
the
conference.
Symposium on Yoga Research. Yeah.
So, you know, I want to thank you for bringing this into a kind of rigorous discussion with physical therapy. Thank you again for being here. Please help me thank Laurie Fazzo. Thank you both very much. I hope you'll be here a little bit so that all the questions that are sitting in the audience unanswered can come to you. I'd like to draw your attention now to a very important topic. It's okay. And that is, you know, we've dealt with mindfulness yesterday. For those who were here yesterday, we've dealt with mindfulness. We've dealt with meditation. We've talked about yoga therapy yesterday. What we have not yet discussed is a very profound element in this holistic system that comes from Indian traditional medicine, and that is, of course, Ayurveda. So today we have with us, we're very fortunate to have with us, he's come all the way, and we are, you know, it's rare to have him give these kinds of talks here. So I want to welcome Dr. Jayarajan Kodikannath, and he is the Academy Director of Kerala Ayurveda, which is an academy for Ayurveda, and also it's a clinical practices for Ayurveda. They train a very large number of Ayurvedic physicians here in North America as well as in India elsewhere. And he is currently on the board of directors of the National Ayurveda Medical Association and the California Association of Ayurvedic Medicine. He is an accomplished teacher for advanced courses in Ayurveda. Trust me, I know his students. They have incredible respect for him. He served as the Chief Medical Officer of Ayurvedagam, and which is a heritage wellness center in Bangalore, India, for more than 10 years. Dr. Jayarajan is actively involved in the various research projects of Kerala Ayurveda. He has presented several papers on Ayurveda in national and international seminars. He has served on the curriculum committee of Bastyr University to create the Ayurveda program and is a founding member of the Council for Ayurveda Credentialing. We're talking about the problem of uncredentialed professionals. So please thank him for that, and I welcome Dr. Jayarajan.
Namaste, everyone. I'm so glad to be here. I'm an Ayurvedic doctor from India. I've been a clinical practitioner for more than almost 2 decades. So yesterday onwards, I was listening to all the lectures. I was expecting that at least one person will set some foundation for me in Ayurveda so that I can take on from that. But I think I will have to put the foundation also today. How many of you are aware about Ayurveda?
I don't know what you mean by aware.
About the principles or the system. Okay, okay. All right, no worries. So we have a little bit to go through, and I need your full attention and focus. So hold on to the rails. Let's start this journey, right? Okay, very good. And also I need to tell you that even though I have been here last 4 years heading academy, about 50% of me is still in India. So if my accent, if you are not able to get something, you can ask me after the presentation or in between. Thank you. All right, Ayurveda. We are talking about a system from the Vedic, systems of India, ancient India. And as you know, the Vedic period, right? It's 2000 BC minimum. 2000 BC, we are talking about 5,000 years, right? A system which is set 5,000 years ago. But don't think that it is outdated. I would say Ayurveda is more relevant today than ever before. And it is a sister science of yoga. Yoga and Ayurveda share the same fundamental philosophies, the principles, and even the practice. If you see the literature, the ancient literature, Ayurveda and yoga are practiced together, born together, developed together, and practiced together. Now it is coming across the globe. There is increased interest, like the yoga. Ayurveda has a lot of interest coming. So let's move forward. What is Ayurveda? A system that implemented transplantation of surgeries even before 1000 BC. Sushruta, the ancient surgeon of India, period is 1000 to 1500 BC. Father of modern medicine, Hippocrates, 240 BC. We are talking about surgeries done maybe 1000 years before the modern system. A system that identified 20 stages of diabetes and high blood sugar, right? High blood sugar as the 20th stage. Ayurveda explains 20 types of or 20 stages of diabetes. In the 20th stage is the current diabetes, that is the high blood sugar. So we can identify even much before getting into the hyperglycemia situation. A system that explained the physiology of memory, speculation, and instinct, including when you see the Bhela Samhita explanation about the physiology of memory, he very clearly says that all the perceptions goes and sits here, bhruvor madhye sringadahastaha, in the cerebral cortex. And while you sleep, it is getting reconsolidated. Very clear explanation of physiology of memory, and goes even to the speculation and instinct. A system that covers all the facets of human existence, physical, mental, and spiritual. It connects all the human life. A system that clearly stated that the manipulation of nature is equal to manipulating yourself, because there is no difference between you and the nature. When I teach, I always explain our students that the new, the genetic modification or whatever changes you are going to do, today's nature is tomorrow's you, and today's you is tomorrow's nature. And that is one of the fundamental principles. Everything is made in this cosmos with the same fundamental principles, same fundamental materials. What is in us, what is there outside? What is there outside, that is, within our system. Humans are beings only when the physical body combines with the senses, mind, and spirit. And health is the harmony of all levels. And Ayurveda explains that the mind and body are not two units, it's a single unit. Any problem affecting your physical body will affect your mind and vice versa. I know that many of you are aware about it. Still, I wanted to just, reiterate those. Life is a period of time in which constant and incessant flow of material and energy happens through one form. That is the definition of life in Ayurveda. The nature is flowing through us every day, right? We are eating every day, we are drinking water every day, we are breathing every day, we are perceiving this world every day through all the five senses. These are the only four inputs in our life. We call it as ahara. Ahara means taking in, aharanam, taking in. Only four inputs, the whole life. Food, water, air, and perceptions. What we are going to be, whether we are going to be more fiery or more cold or more stagnant or heavy, lean, all depends upon these four inputs. So how to manage those inputs in our life is the core focus of Ayurveda. All the digestive, metabolic, immune and healing system are within the patient, and hence patient is the healer. One of the foundational principles. The digestive system is within the patient, metabolic system is within the patient, immune system is within the patient, healing system is within the patient. Who is the healer? The patient is the healer. Then you may ask, what are you doing? You are an Ayurvedic doctor for the last 20 years, then what is your job? Our job is to help the individual understand what is their basic nature and what is the imbalance. Each and every disease is an imbalance. Once we help them to understand what is their nature and imbalance, then we connect them to the nature. Nature has all the resources, right? Nature has all the resources. From the single cell, we started our life as a single cell in mother's womb. From that single cell till today, who fed us? It was the nature who fed us, right? It was the nature. So nature has everything to make us grow, maintain, nourish, nurture, heal. So after helping an individual to understand what they are and what is their imbalance or the disorder, then we help them to identify the right food, the right routine, the right herbs, the right formulation. And it is between nature and the patient the healing happens. So we create the right space, right awareness, the right energy in the process of healing. The healing is happening automatic within the patient. Right? You agree with me? Of course, yeah. So mind and body are functioning together as a single entity, and hence we can heal body through mind and mind through body and body through mind. The Ayurvedic interventions are never a magic pill for a problem. Never. It's a combination of what a patient can do for themselves, that is more important. And of course, there is a strong clinical side of Ayurveda with herbs, formulations, detoxification, rejuvenation, an array of process. Then of course, yoga, pranayama, meditation. It's a very comprehensive system that covers the entire levels of human life and existence. Those who are new to this information of Ayurveda, the definition of health in Ayurveda is very comprehensive. It's not about your body weight and your height. It is not about your numbers in the blood. It is much beyond. It's much beyond. It covers the physical aspect, the mental aspect, spiritual aspect, and the emotional aspects. It's a balance of everything. This is the graphic representation of the same definition, right? The balance or the health is a balance, the correct union of primarily these four entities. Dosha, the functional energies, I will talk a little bit about that, then only you will be able to follow my coming slides. Then Agni, the digestion and metabolism. Agni is the key. Agni is fire, the Sanskrit terminology for fire. Fire is everything, right? Fire is everything. What is the function of fire? Transformation. The food is getting digested into nutrients Who is doing that? The digestive fire, the acids and the pepsins and the salivary amylase. It's a group of, it's a conversion. Then the metabolic system is converting these nutrients into tissues and energies. What is happening there? Metabolic fire. We call them fire. So fire is the energy that helps this flow of external material into internal material and internal material into external material and energy. The banana you have eaten today, it became you within few hours. The banana became you, right? Banana broken down into nutrients. Those nutrients got absorbed by your system, became your tissue. That means banana became you, correct? So Agni is the one that helps in the transformation. Then the tissues. There are different levels of tissues. From blood, the nutritive essence, up to the nerve tissue, the reproductive tissue, the fat tissue, bone tissue. Then excretions. Cleaning process is very important, right? The elimination is very important. A clean system can only behave normally. Otherwise it causes more stagnation, blockage, and other issues. And finally, you see the center point? Mind is the connection point that makes this flow possible. Moving forward, I don't want to make it too much complex. I will make it very light, okay? So there are only 3 functional energy that is making the entire cosmos function, not only human body, the entire cosmos. There are only 3 types of energies. One is the glue energy that keeps all the materials within the cell to form a cell, all the cells to form a tissue, all the tissue to form an organ system, and all the organ together to form this body, right? We are not, just flowing like sand. We are kept intact, in correct integrity, the cohesion, the binding. That glue energy is called the kapha. Very important for stability, very important for nourishment, very important for sustenance. Second energy is the energy of transformation. We call it pitta. It's nothing but fire. The same principle, conversion, external material into internal material and into tissues and energies. And the third principle is the energy of vibration, the energy of movement called vata. Our physical activities, involuntary movement of heart, respiration, movement of thoughts, all the dynamism. The correct balance and coordination of these 3 principles. So the glue energy, the transformational energy, and the dynamic energy, the correct balance helps in the entire, normal function, balanced function, physiological as well as psychological. So bringing this harmony is important. Now say, if your glue energy is more, so what will happen? It can cause more stickiness, more stagnation, more heaviness, more sluggishness. If your fire energy is more, you can burn yourself out, right? Like a hyperthyroidism, what happens? You start burning more than what you are supposed to, right? If the principle of movement is more than what is usual, you can get different disorders like movement disorders, restlessness, unable to sleep, insomnia, one of the main, outcome of vata imbalance. Because sleep is nothing but mind at rest. When your principle of movement or your stability goes down, the mind cannot take rest, so you cannot sleep. So insomnia is considered as one of the problem. Just to give you a connection, I am giving some examples. Good. What about mind? This is the another next layer. The cosmic qualities. We are, it's like I usually use the analogy of cauliflower. You take a cauliflower and consider that as the cosmos. And you cut a piece of that cauliflower. It will also resemble the same mother cauliflower, but it's small in size. The same way the human system, each one of us, we have a cosmos within us, resembling the same cosmos. Now you take one of your cell, that will be a small piece of this cut cauliflower. It will have all the elements, all the energies, all the materials, right? So the same way, these are all cosmic qualities. There are again the mental qualities are into 3. What are those? One is the extreme activity. extreme activity, intensity, violence, or restlessness, the movement in intensity, that is one extreme activity of mind. The other extreme activity is tamas, the other end. One is extreme, intensity and activity. Other side is extreme inertia, stagnation. It is called tamas. Tamas means darkness, dullness, can cause stagnation. And there is a space called sattva that gives more clarity and purity. Sattva is a clarity, a principle that is pure and clear. Right? Now, what is good and what is bad? We always say sattva is sattva, where we need to be, is in the sattva space, the clear space, purity, clarity, devotion, trust, right? But, the human system has all the elements. How you can nurture this sattva and minimize this extreme activity or extreme inertia? Minimize that and nurture this. That is the mantra for better, health, mental health. Okay? So I wanted to just touch upon some of the principles. Now I am going to the topic, stress. What is stress? Generally, we say stress for, my relationship is very stressful, or my office is very stressful, right? Generally, we use the term stress for only the mental stress. Actually, Ayurvedic definition for stress is much beyond that. Ayurveda says, Kaya vak chitta bhedena karma bhivibhajetritha tatra kayadi karmano adipravartir atiyogaha. This is from one of the Vedic texts. They are very clear. There are three types of actions, three types of activities happening in our human life. Kaya, vak, mano. Physical, kaya means physical, vak means verbal, and mano means mental. There are three types of activities, only three types of activities. Physical, mental, and verbal. And what is stress? When you go beyond your threshold in any of these activities, that is called stress. You as a human being, you may be very strong physically, mentally, in all, but still you are a human being. There is a limit up to which you can stretch your capabilities, right? When you stretch your capability beyond your natural threshold, that is called stress. For example, if you can eat one sandwich, one day the sandwich was very tasty, you try to eat 3. It's a stress for your digestive system. Right? It's a stress for your digestive system. You can easily, lift 50 pounds, but you are trying to lift 100 pounds. It's a physical stress. Whenever you need to stretch your capability beyond your threshold, that is called the stress according to Ayurveda. That could be physical stress, mental stress, digestive stress, verbal stress. Only Ayurveda. I have, researched in modern systems, all systems. I have not seen a distinction between, I was able to figure out physical stress and mental stress, but not verbal stress. It was Charaga and Vagbhada who brought that. And they mentioned that the verbal stress is much more stronger than other stress. Because a person shouting it at another person, the person shouting is also under stress, and the person hearing is also under stress. And its impact can affect both body and mind. Okay, so stress is much bigger than what we think. Right? Here it goes. How stress leads to various health problems. Stress leading to various health problems. Physical stress, verbal stress, and mental stress. And usually, if you are strong enough, you can handle more stress. Something stressful for me may not be stressful for you, because your system is strong enough to handle that. So whether you are going to get stressed or not depends upon how strong your system is, how stable your system is. That is why I mentioned, in weak mind it is very easy to get into the problems. Now, a stress comes, whether it is physical, verbal, or mental stress. How it acts on the system, how it develops as a disease. This is again, all the slides and information here, I'm just translating the Vedic text, nothing from my pocket. Let me give you that information. Nothing from my side as a, I think so. This is all, I'm trying to explain you from the Vedic text. Okay, so as stress comes, you as an individual, you have a particular nature. Some people are a little bit irritable. Some people are, they will withdraw from that when the stress comes. Some people will be fighting against it. Some people will stay still, hear everything, and act in a balanced way. There are different types of responses, right? So if somebody is reacting to it in a very aggressive way, we can consider them as the Rajasic. The stress is getting influenced by the Rajas, or the stress is affecting the Rajas side of that individual. They will get panicky, they will get angry, they will get irritable, they will get restless, right? That disturbs or aggravates the two principles which we mentioned, the fire principle, the Pitta, and the activity principle, vibrational, dynamic principle called Vata. So you become more restless, unable to rest, and you are intense and fiery within you. So that dynamic change, the energetic change within the system will get percolated into both mind-body channels. When I say mind-body channels, there are different issues, right? There are materials and energy flowing through the system. It's a very complex system, right? So there is a flow of energy and material happening. So whatever coming from outside, it is getting percolated. Like you are putting a drop of ink in a bowl of water. What will happen? The ink will just percolate through the entire water, right? The same way, any stimulus, physical, mental, emotional stimulus will get percolated into the entire system, right? Finally, it develops various mind-body problems, diseases. For example, it can, anxiety is one of the either Pitta or Vata Pitta imbalance according to Ayurveda, right? And it can lead to many other systemic problems. I'll take you to one slide. Anxiety, what are the physiological, or physical diseases it can cause? The stress and anxiety, according to, Vagbhada and Charaga. All right? So this is one. On the other side, if the person is more a withdrawing type or a dull type, they are getting influenced by the tamasic nature of it, then what happens? It influences the kapha, the same stress. And you can see this, I have done many studies. I was doing certain corporate programs in Bangalore, and I've done many studies with a big group of people. The same stress. Same boss doing the same job, employees, working in the same office, stress, somebody is not feeling like eating and drowsy, and few other people are eating and compensating the stress. Some people are getting restless, some people are getting, depressed. So according to each individual's status or nature, it changes. So if it is affecting the dullness of the system, or the depressive state of the system, or the dullness of the mind, it gets into the kapha, which is the glue energy, the sticky energy, that affects the mind and body, leading to depression. The same stress, one person develops anxiety, the other person develops depression and problems, right? Depends upon who you are. So I liked Dr. Lowry's comment that it is not that, for arthritis you do this yoga, or diabetes. It's all about who is this patient, right? It's not only about the diagnosis, but the person, the age, the constitution. There are many parameters that makes it more a personalized, customized, because each individual is a separate entity, not the same, right? Okay, so this is the impact of stress on various systems, physical and mental systems. Now, this was, while researching, this is the, the symptoms of anxiety mentioned by Charaga. I know that you didn't understand anything because it is Sanskrit. But I have the next slide. This is from Hutchinson. It is exactly as if Hutchinson translated Charaga. The same presentation. You can go and refer. So I translated Charaga. When I was researching on documents, I found that Hutchinson is saying same thing, except one difference. Charaga mentioned about verbal stress. Hutchinson, he has not. Right? Otherwise, the physical and mental the expression of anxiety it was almost the same presentation. Now, how this affects the stress leading to anxiety and how it's impact our system and what is the remedy? Ayurveda very clearly says when your mind is unstable, when your mind is anxious, when your mind is restless, your anxiety, when it goes, it's like a seesaw. Your memory, your focus, your mindfulness goes down. Your smriti goes down. Your anxiety goes up. Your smriti is both for mindfulness and memory. Right? Smriti in present moment is mindfulness. Smriti of yesterday is memory. Today's mindfulness is tomorrow's memory. Right? Yes. This is from Yoga Sutra. Anubhuta Vishaya Asampramosha Smriti. Definition of Smriti. What is memory or mindfulness? It is the faculty of the mind keeping the sense perceptions as is. You are not judging it. You are not manipulating it. If you are observing whatever it is. You are retaining. If you are perceiving that in this moment, that is called mindfulness. Without judging, without manipulating, you see, you hear, you understand as is your mindfulness. Now this moment, I am mindful about what is happening. After one moment, it became memory. So how you perceive now is the memory for tomorrow. Right? So if you are getting a distorted perception now because of your anxiety and restlessness, your tomorrow's memory is distorted. So mindfulness is a very, very important tool to have a better balance, harmony, and better memory and awareness about life. Okay. How we perceive this world. This is from Tarka Sangraha, one of the philosophical foundation of Ayurveda and Yoga, Tarka Sangraha. There are 6 ways of perceiving the world. Either you see something directly, it is called pratyaksha, I am seeing you, right? Then in the afternoon, I am not able to see you, but I can hear you. Because when I hear you itself, I can visualize you. That is the next one. I am seeing you and hearing you together. That is the samyuktam. Samavayam, samyuktam, different, type of perceptions. You can even perceive the absence. You know that? I can ask that, hey, there was a black pen, I kept it on this table. Where is that? By explaining the context, you can perceive the absence of something. So Tarka Sangraha mentions about 6, ways of perceiving this world, like directly connecting. When you have the quality, you visualize. When you have the both quality and the direct perception together, and the absence, there are different ways of perceiving this world. Then what happens? Once you perceive through your 5 senses, it goes and imprints. It is called samskara. This is the process how we can manage the stress and create a better memory and mindfulness and have a balanced outcome. For that, the first perception is very important. Then it goes and imprintment, like the seal. How you perceive, it goes and imprints in the system. If there is imprintment, then only you will be able to remember. You are walking in the street, somebody is coming in front of you, and they are passing and going. You are not remembering who it is. Why? You didn't perceive, right? You didn't perceive. If you saw, talked, and if you have that imprintment, then only you will be able to remember that person. So this is about the mindfulness and the memory. The memory. And Ayurveda says, memory is not storage. We think memory is storage, right? Even for computer or human beings, we say, when you have lot of data within you, we say that is memory. Ayurvedically, memory is the act of connect between the present perception and the past sense perception. That connect is called the memory. So here an object, you are looking at an object, you are getting the perception, and it is getting stored in the mind. This axis is called the mindfulness. You are keep on putting all the data from time to time. You are in present and able to perceive. It is getting stored. Your next day or after next month, you are seeing the same person. You get the perception at that time. That is also mindfulness of that particular moment. When you connect today's that image with the previous image, that is called memory, that act of connect. Okay? Anubhuta Vishaya Asambrahmoshaha Smriti. All right. Now what happens in stress and anxiety? You are perceiving, the object is coming, but your mind is not at rest. You are anxious. You are restless. You are not able to focus. You are not mindful. So what happens? Somebody is in front of you talking to you, but it's just going, over the head. It is not going in. So finally what will happen? After attending the class, the 45 minutes of a lecture, teacher is asking a question. What is that? Student is looking at the teacher. What happened? She was somewhere else. Her mind was somewhere else. The lecture, she was present, she was looking at the teacher, but it has gone over the head. So if your perception is not complete, there is no samskara. There is no storage. Even after 10 minutes you ask, you don't know what. You were present there, you were looking at the teacher, no idea. Mindfulness is very important. Now, if there is a perception issue because of the anxiety, the stress, the restlessness, what will happen? After some time, when they ask or when you want to collect, the mind will ask you to go and check the storage, the library, the main library, but there is no data stored, so you are not remembering it. So stress can affect physical system, digestive system, mental system. This is a small chart. When you have an anxiety due to stress, how it can impact your physical system. This is again from Charaka Samhita. Okay? How it can affect each system. In respiratory system, it can develop as cough or asthma, or it can cause degenerative changes. In digestive system, nausea, weak digestion. And nutritional system, weak absorption, fever or inflammation. Jwaram means fever or inflammatory changes, or it can cause anemia. And in blood, it can cause, skin rashes. The skin and blood are directly connected according to Ayurveda. Liver, blood, and skin. So you can develop into skin rashes, anemia, or autoimmune skin disorders. In muscle, like hemorrhoids or fibromyalgia. In fat system, diabetes or obesity. Bowel system, hemorrhoids, constipation, and diarrhea. Urinary system, difficulty in urination or urinary urgency or frequency. Inflammation and infertility, amenorrhea and dysmenorrhea, and psychosis, seizures, panic attack. One stress, one incident of stress, or a series of stress can cause any of this or multiple of this. Then you may ask me, okay, all people are not getting all the problems. Some people are getting menstrual disorders, whereas some others are getting diabetes due to stress. Some are getting anxiety. Why different people express in different way? The answer is, Ayurveda says, according to which system is weak in you, susceptible in you, that system will show up the problems. If your menstrual system is weak, you will develop dysmenorrhea. You may not develop diabetes. But your metabolic system is weak, you will develop diabetes, not something else. So according to which system is susceptible, which system is vulnerable and weak, the stress and anxiety can create problems. Then the question is, okay, what is the remedy, right? How to help? It's very simple. Ayurveda is a very simple science. It is not at all complex, except certain Sanskrit words or terminologies. Otherwise, the principles are very, very simple. Anybody can implement Ayurvedic principles in life. It will fit anywhere because it's the science of life. An allopathic doctor can use the principles, an acupuncturist can use, a yoga therapist can use, or a mom can use at home. Everywhere it fits. All right? So you have only two options to handle stress. Only two options. If stress is stretching beyond your capability, if stress is overloading your system, you have only two options. What you can do? One, you make your system more stronger. If you are more stronger, you can hold more, right? It is logical, right? If you are more stronger, you can take more. So you need to strengthen your physical system, you need to strengthen your mental system, your emotional system. Make it more strong so you can hold more. That is one way of managing stress. Rather than not waiting for the symptoms, you be proactive and make you strong. That is one. Second is stabilizing the mind-body systems. What is the meaning of stabilizing the body-mind systems? We are all intelligent, we are all capable, we are all strong. Then why we are getting into stress and related problems? Many a time when a crisis comes, when you face a crisis, that may be a minor or a major crisis, if you are not stable enough to look at the crisis, understand and resolve, these are the only 3 steps what we can do, right? Any problem in our life, 1, understand what is the problem. Second, see what is the best option to handle that at that point of time and implement it. That's it. That's it. Observe, understand, mindfully understand the problem. See what is the best option. You may not have a perfect option at that time, but best available option and implement it. If you are stable in that process, you will be able to use 90 to 95% of your efficiency to handle that problem. In place of that, when a problem comes, oh my God, what to do? What is going to happen? You are getting anxious, you are getting panicky, you are getting restless. More than 50% of your available energy you will spend for unnecessary thinking. What will happen? Your outcome will be just with 40-30% of your efficiency. So stability of the system, the mindfulness, stability and the harmony of the system will help your human potential to be utilized for handling any problem in life in an optimal way. So stabilizing the body and mind systems and strengthening the body and mind system, these are the only 2 options for us to handle stress. We cannot avoid our profession, we cannot avoid our present day life. We are living in present. Whatever happening in present, we need to face that. So how we can proactively involve in that, that is the main question. Okay, now how to do this? How to strengthen the system or how to stabilize the system? You have Vedic sciences provide hundreds of options to you. Hundreds of options to you. Not a magic pill or not a magic asana. It's a combination of a series of processes. In that, a good number what you can individually do. Of course, there is the other side of yoga therapists, how they can help you, Ayurveda practitioner, how they can help you, and a spiritual counselor, how they can help you. It has all the 3 layers, right? The 3 layers of living. The physical layer, the subtle or the energetic layer, where there comes the mind, the vata, pitta, kapha, all the energies. The functional layer, physical layer, functional layer, and the causal layer or the conscious layer. These are the only 3 layers of existence. Any living being, right? Rigveda very clearly says that. There are only 3 layers of existence. When these 3 combine together, then it is called living being. Living being, right? The physical plane, the subtle or the energetic plane, and the conscious plane, right? Okay, so how you can help the entire process of handling the stress, managing the stress or stress-related complications through the body. First, as I mentioned, maintaining the inputs in our life, maintaining the inputs in our life. What are the inputs? Food, water, air, and perceptions. What you eat, how much you eat, when you eat, right? If you are eating spicy food, definitely you will get more sweat and you feel hot, right? Each and every material in this world, in this nature, has a specific function. You eat a chili pepper, definitely you will get sweat and, right? You eat a sweet and heavy, deep fried item, you feel heavy and dull because it has the quality of heaviness. So according to what is in your system required, for example, if you are a fiery person with acidity and irritability and inflammations, you may need more cooling item to your system, right? You may have to take more cooling item. You may have to drink more water because water is the best remedy for fire. Very simple, right? You may have to drink more water, then no acidity, right? So according to what energy is more prominent in us, or what are the energies that is creating problem, you may be able to identify the right material to eat, the right medium to eat, the right quantity to eat. So food, water is the best cleanser, right? If you are drinking proper water, quantity of water every day, no need of too many additional cleansing, because it will activate all the 3 routes of possible elimination from our system, the bowel, urine and sweat. When you drink more water, more urine, more sweat. Very simple, right? So drink sufficient quantity of water. Air, the breath. Pranayama is identified as one of the best tools in any health problem. You know, when I was a chief medical officer of Ayurveda gram in Bangalore, yoga and pranayama, you know, it's Ayurveda and yoga. It was 50-50% in all our protocols. In Kerala Ayurveda system, we try to implement that. And I had even obese cases of 400 pounds and more, unable to walk because osteoarthritis. I cannot say do any exercise because they cannot move. You know, by the time coming to the consultation room, 10 feet itself, panting. Pranayama was the best tool what we have used. I have many case studies in my file, how it helped. Just simple breathing techniques. It's all about balance. It's not about pushing the system too much. Okay, good. So perceptions. Life is so beautiful. Take it easy, enjoy it. Don't make it too tight. I try to counsel all my patients coming to us because, you know, the main thing is our perception. You know, what is going to happen tomorrow? What is going to happen tomorrow? We know that one day we need to go from here, no doubt about it. Nobody is permanent, right? As long as we are alive, how we can support ourselves, our family, friends, community, and be happy, right? So many a time with our learning, we won't realize that. We get too tight, the system. We forget to live today, thinking about tomorrow and worrying about tomorrow and thinking about what happened yesterday, right? So the perception, the mindfulness, the counseling, to be in present, that helps a lot in handling the stress, anxiety, and related problems. Lifestyle. What is lifestyle? What you are doing in a day regularly is your lifestyle. What is your job? When are you sleeping? What is your habit? What are your activities? How you are managing a day in a regular basis is your lifestyle. So there comes the routines, the practices, when you are sleeping, when you are getting up. Ayurveda says a late night is not that great, those who are prone to anxiety and rest. Late nights always aggravates the vata, the restlessness. It creates more disturbance in the system. So various practices every day. You know, I usually say that you are very busy, I know you don't have time, but still you can spend 5 minutes for your health a day, right? Get up, clean up yourself and sit and at least close your eye and watch your breath for 5 minutes. That itself, you know, like calling Johnny. When Johnny, the small boy, doing lot of mischief, one call from mother, Johnny, that's enough. No need of too much explanation. Johnny stops all the mischief and okay, that call is enough. The same way, call yourself at least once or twice a day. Sit and watch your own breath and see who you are internally. That itself is calling the Johnny. Otherwise, mind will be like a Johnny doing all the mischief. So calling the Johnny 1 or twice a day would be a very good idea. Sitting 5 minutes and calling the Johnny. It's a good idea. Okay, so rituals, yoga, pranayama, simple, you know, process in the life. It helps a lot. Detox and cleanses. Now, you may get a person, those who are practitioners, you may get a person with already contaminated or already stagnant, accumulated problems, multiple problems. Just food routines and sleeping early may not be sufficient. You may have to do something from the clinical side of it to bring them back onto the track, right? There Ayurveda has a lot of offering. Ayurvedic detox programs are globally known. We call it as panchakarma. There are 5 procedures mentioned to cleanse the system, to make the system more clean and making the function normal. Then rejuvenation. Rejuvenation means strengthening. Anti-aging. It's a very, or whenever we talk about anti-aging, all are, really anxious. What is that? It's a magic pill or a magic cream to make the anti-aging. It is not a magic pill or a magic cream. it includes all these practices, your food routine, etc. You know, so now how to work through mind, working through the mind and helping the system. Mindfulness and awareness. Many a time we can resolve many issues by just shifting the face of the patient, not physically, but their perception. Just they are looking at the problem like this and keep on worrying. You may have to shift a little bit. The issue will solve in 20-30 minutes of putting their perception in the right frame of mind. Meditation, a great tool. Yesterday and today, you know, many people discussed about it, the scholars who have done a lot of work on it. Yesterday's speech was great. And devotion. What is the meaning of devotion? Trust in something, believe in something. It's totally up to you what you want to. You want to believe in just nature and consciousness, that is fine, but please believe from within. Many a time when people come, they are really worried about what is going to happen. Then I ask them, do you believe in something? Yeah, I believe in God. I go to temple every day. Then why you are worried? Then what is your belief, right? You are believing strongly in something and you are worried about today, what is going to happen tomorrow. Then what is your belief? Your belief is there is this, the power or the God will help me, guide me, support me to make my tomorrow better. I am sure that I am supported, I am guided, I am blessed with that. If you are strong in that belief, then why you are worrying, right? If you are still worrying, you need to question yourself about how strong your belief is, right? So devotion, believing in something and moving forward. Everything will happen, in a normal way. Sensory therapies, music therapy, color therapy, touch therapy, aromatherapy, all very well known globally. And it's a part of the Vedic sciences, including the music and dance. Gandharva Vedam is nothing but the science of dance and music. And Vedic, civilization, Vedic tradition has contributed a lot. My mission personally to bring the Vedic wisdom, and it's for the mankind. It's not for one group or one state or one. It's a great treasure, a great storage of information for the humanity to help. That is the passion. That is the process. And I'm so glad to be here today to give this information. So, yeah. So there are a lot of therapies, purification, rejuvenation. I'm sure many of you are familiar with it. So a variety of hundreds of processes according to the constitution and condition. Thank you so much for listening to me. Namaste. Any questions? Please.
Where is your academy located?
We have 4 locations. In Los Angeles, it's in Culver City. We are running the program with International Sports Medicine Institution and Institute, and in Culver City. Then Seattle, Washington, Fremont, California, and Boston, Massachusetts. We have 4 locations. And we have e-learning systems.
I have one quick question.
Please.
I think the audience would be interested in finding out, do you have didactic part of your program online?
Yes, it is available. We have a good e-learning system. We have a lot of students joining from various parts of the world. We have provided the course material, even the real-time classes we shot, and the videos are available, quizzes, home study guides, library, Sanskrit dictionary, everything is available in our e-learning system. And we do conduct virtual classroom sessions, weekly virtual classroom session, real time, so they can ask questions and clarify. Yeah. Yes, please.
The impressions of experience, the samskaras. Are the samskaras in the body, the mind, or consciousness?
Oh, okay. All right. Samskaras in all levels. Samskara is in all levels. Not only the physical experience, not only the mental experience. And as all of you know, the self, the consciousness is a witness. There is no disease of consciousness. There is no disease imbalance to the consciousness means the soul, the spirit. The soul, the spirit, the consciousness is a witness. where the disorders in imbalance happens in only two planes. There is a physical plane and the energetic plane. When we talk about energetic plane, the mind is in that plane. Yes. And they are all interacting each other. Yes, please.
Hold on, Sharon.
How do you find your dosha? How do you figure out what your dosha is?
Okay, very simple. Darshana Sparsana Prasnehi. Observation, touch, and questioning. We have only 3 assessment tools from the Vedas. Only 3 assessment tools. Observation, touch, and questioning. Yeah. So a learned practitioner will be able to observe your system, touch and feel. Pulse diagnosis is one of the main important tool what we use. We teach that in our course. Then of course, lot of questions about your history, your family history, and history of the problems. Yeah, observation.
Dr. Smirnov had a question.
Yes, please.
Okay. I have a question about the quality of mind, and you say there are 3 aspects.
Yes.
Rajas, Tamas, and
Sattva.
And Sattva. It look in a symbol that depicts. It looks like they're all kind of in balance, or all connected to each other. When I read the description, I see like Sattva is something that we all want, and everything else that we kind of a negative in a way. Could you clarify?
Very good question.
Or do we need them all?
We do. The life is, everything is there in life. Like in the world, everything is there in life. See, Sattva and Rajas, Rajas and Tamas are considered as the quality which can create imbalance. Because extreme activity is an imbalance. Extreme inertia is an imbalance. Whereas Sattva stands for clarity and purity, it is the ultimate balance. So Sattva is a positive quality. That is why always Sattvic lifestyle means elevating the Sattva. That which can enhance the Sattvic nature is a Sattvic lifestyle. This is what we need. But we have every energy is working, right? How you can minimize the 2, Rajas and Tamas, and nurture the Sattva, that is the only question. Pure Sattva is an idea, right? So how close you can reach, there is the question. How close you can reach is the question. Good question, thank you. Yes, please.
The field of epigenetics is now showing that we have genetic changes based on our early childhood and even ancestral, which sounds a lot like Vasana to me. And I'm just curious if you could speak a little bit as far as success with working with samskaras, with people with this Vasanas. Like we have today's world, a lot of children growing up with a lot of stress in their life.
Yeah. See, we are in the cosmic dance, right? The cosmic dance is going on. And the nature is very flexible. Our body is very flexible. Body and mind both are keep on trying to help you. But if you are keep on abusing and creating imbalance, after that the threshold goes away. And the entire system, the nature, the body, the entire beingness has the flexibility of adjusting to the changes, right? From the age of dinosaurs to something else, then it's evolving. How it is evolving? According to the changes happening. If you are not using your one hand, many generations, you are keep on, that hand will become useless, right? Our vermiform appendix, now it is not totally functional like a cow. Why? From that raw, we were eating only raw food when it was, before inventing the fire. At that time it was very active, that organ. Now it is not fully functional like a cow. Why? After inventing the fire, human beings started eating more cooked items. Now the chlorophyll digestion is, it is not a major part of it, right? So the same way, the system is always, according to the flow of the Maya and the flow of the cosmic dance, it adjusts, readjusts. So that adjustment in the gross level, what is adjusted in the previous generation comes to this generation, and there are samskaras happening in this generation. Then that will get transferred to the next generation. So there can be, the flow happening. what shift you are making into your system, that shift will get transferred to the next generation. If you are creating diabetes on your own this generation, you can contribute diabetes to the next generation. Many a time when we consult, patients will say that, what to do, my parents, both of them are diabetic. As if, I got it, what to do? But we need to ask one question, how many diseases we are adding to ourselves and giving to the next generation? So the genetic disorders are increasing because we have not done anything to reverse it. How to reverse it? You take care of yourself very well not to develop the diabetes even though your dad is diabetic. If you are not able, if you are able to keep it under control, your child may not get it because you are already in a positive. It's a reversal through generations. I don't know how many generations it will take to wash it off.
This is our final question.
Yes.
Philip Goldberg had his hand up for a very long time.
Could you speak to the training of Ayurvedic practitioners and if there's anything parallel to what Laurie was speaking about before about the standardization,
very good,
the regulation?
Very good, very good. Yeah. I'm on the board of both our national organization and the California Association. We are setting the standards and creating a self-regulated system. So right now, in this country, we have Ayurveda Wellness Counselor program, the state. It's a vocational training right now. It's not a, the regulated practice. So we have Ayurveda Wellness Counselor program. It's a one-year program, primarily focusing on prevention and life enhancement. It covers all these elements, even Ayurveda and yoga connection. Then Ayurveda Wellness Practitioner program is an advanced program where more clinical side of Ayurveda, Ayurvedic management of various system disorders, then gets into the masters of Ayurveda. So the Ayurveda, like yoga, Ayurveda is also growing in this country. A lot of accredited programs.
Is there any effort to standardize it like Chinese medicine is now licensed by states? Is there
It's a process, of course, in the same process. But, there are some worries in between, as this morning mentioned. Regulation, one way, it is more visibility, more people will be able to come, and there is more. But, you are setting into a very fixed box. So, especially systems, Vedic systems like Ayurveda, we need to have a lot of flexibility to help people. Lot of flexibility. If you are not flexible, you cannot help because each individual need a different protocol. So, anyway, but it's a flow. It will happen the way it need to be. Thank you so much. If you have any question, I am here. Thank you. Thank you. Thank you.
Thank you, Dr. Jayarajan. That was enlightening, informative, erudite, and I think there will be people who are interested in your program. The program is at Culver City. It is at Fremont. And, of course, didactic parts are online as well. Thank you so very much.
We have the information if you want, and if you are interested in understanding, learning, even the basic course, whatever it is, we have information.
I just want to take a second. Yeah, please do thank him. Thank you. I want to take just 1 second to acknowledge this morning the School of Religion. We have the director of the School of Religion here, Laurie Meeks. Laurie, give a nice wave out. And I'm going to be introducing Dean Soni for the next talk in a minute. I also want to thank once again Dharma Civilization Foundation, who has sponsored this event and other wonderful events here at USC, the chairman of Dharma Civilization Foundation and the president of Dharma Civilization Foundation, and some of our board of trustees is here. I'd just like you to wave out if possible or stand up. Dr. Manohar Shinde. Professor Shiva Vajpayee is the president of Dharma Civilization Foundation. Thank you. And Sri Sunil Agarwal, if he's here. Thank you.
Well, hello, everyone. Can everyone hear me back there? Is this microphone good? Great. Okay. My name is Varun Soni. I'm the Dean of Religious Life here at USC. I'm also an adjunct faculty member at the USC School of Religion and a University Fellow at the Annenberg Center on Public Diplomacy. I'm very grateful, extremely grateful, for the opportunity to speak about mindfulness in higher education today and to introduce a new university-wide initiative that we're about to launch probably this week at USC called Mindful USC. And I know that I'm standing between you and lunch, so I'll limit my remarks to about an hour or two. You know, I know you spoke a lot about mindfulness yesterday. My own personal interest in mindfulness started in college when I went on the Antioch Buddhist Studies program and lived in a town called Bodh Gaya in Bihar, India. It's the town where the Buddha was enlightened. The whole town is oriented around the site of his enlightenment, maybe the most important place in Buddhism. And as part of the Antioch program, we lived in the Burmese monastery. We took the vows of a Theravada monk, and I developed a Theravada Buddhist practice, which I later continued in Sri Lanka when I went on retreat there. And that's really where I began to think about mindfulness, really from a spiritual perspective. I wanted to meditate because I wanted to levitate and walk through walls, and I still want to do that. But it really came from that perspective of wanting to understand spiritual and existential questions I was asking. But what I discovered, having developed this practice, was that there were practical benefits as well as spiritual benefits. Better focus, stress reduction, a happier, more creative work environment. And for me, that was a tremendous resource as an undergraduate student and as a graduate student. After I had this experience, I continued my studies at Harvard Divinity School and lived in Boston, and it was an exciting time to be there. It was mid-90s, late 90s, and around that time, folks like Jon Kabat-Zinn and Mark Epstein and others began to discuss meditation in terms of positive health outcomes, in terms of mindfulness-based stress reduction. And because I was in that environment at the time, I was able to plug into some of the initiatives that were happening. And what I began to see is that mindfulness in the American context is really like a type of American Buddhism, at least from my point of view. You know, Buddhism, like every major religion, changes when it goes from country to country. It has to change, otherwise it won't be relevant to the people who practice it. So while every religion has timeless aspects to the tradition, spiritual principles that the tradition is oriented around, when a tradition moves from one country to another, it resonates the ethos and the aspirations of the people and the time that it encounters. And I believe when Buddhism comes to the United States, it comes in many forms, but in a secular context, it looks like mindfulness. Much like when Hindu yoga, the practice of Hatha yoga, comes to the United States, it looks, in a secular context, it looks like a physical or wellness type of intervention as opposed to a spiritual one, even though the roots of yoga are in Vedanta, are in the Hindu tradition itself. In many ways, yoga has been divorced from Hinduism within the wellness context. I live next to a yoga studio called Yoga Yaz, and they take this very seriously. Outside of their sign, their studio, it says the no Om zone, and then it says no Sanskrit, no chanting, no granola. I don't know how Indian granola is, but it's funny to me as a Sanskritist to drive by a sign that says no Sanskrit every day in Los Angeles. It's kind of random, but I think they're similar trajectories. The de-Hindufication of yoga for wellness purposes, the de-Buddhification of mindfulness for wellness purposes as well. And over the last 20 years, mindfulness has gone fully mainstream, not only in the academy, but also in the public sphere. In 1982, Jon Kabat-Zinn writes the first mindfulness research article. And over the next 20 years, from 1982 to 2002, 188 research articles were published on mindfulness, over 2 decades. In 2013 alone, 549 research articles were published on mindfulness. So you can see the exponential growth and the dramatic trajectory of mindfulness research in the American Academy. Now there are over 3,200 academic journal entries on mindfulness, and that number is rapidly growing. And in the popular imagination, mindfulness is everywhere. I'm sure many of you caught the cover of Time magazine in February this year. The Mindful Revolution on the cover of Time magazine focused on the science of mindfulness, not just the practice of mindfulness, the science of mindfulness. And mindfulness has become corporate as well. The best example is Chade-Man Tang, who we're going to bring to USC, and I'll announce that at the end of my talk. He's the Chief Happiness Officer at Google. What a great title. His official title is Jolly Good Fellow. I think universities need fellowships like that. But his job is to really engineer a culture of mindfulness at Google, and he wrote a great book called Search Inside Yourself, which really launched a movement of mindfulness in corporate America. Once again, not focused on spiritual outcomes, not focused on levitation and walking through walls, but more focused on health outcomes and learning outcomes in the workplace. Stress reduction, workplace happiness, decreased healthcare costs, increased innovation and creativity. And you can imagine at a place like Google how important those outcomes are. But what is mindfulness? There's a lot of there are a number of definitions. The scholarly definition from the American Mindfulness Research Association, which is at least partially based right here at USC. The president is a professor here at USC. They define mindfulness as, quote, mindfulness can be defined as the state, process, and intentional practice of remembering to observe moment-to-moment experience with openness and without automatic patterns of previously conditioned thoughts, emotions, and behaviors. Mindfulness can be cultivated through mind-body practices, focused attention and open monitoring meditation practices, as well as other intrapsychic and sensory-based activities that are founded on a discerning mode of awareness and practice-based ethical framework that recognizes wholesome and unwholesome states of being. It's a rather technical definition, but I think there are three components that we can find in mindfulness. One, that it's purposeful. Two, that it's focused on present moment awareness. And three, that it's non-judgmental. And one of the exciting new developments, I believe, in the last 5 years or so is the evolution of mindfulness within the context of research universities. This takes many forms. It takes many different approaches. But there's a very interesting new role that mindfulness is playing within the context of American higher education. And the list of schools with comprehensive mindfulness initiatives and mindfulness centers is truly impressive. I'd love to say USC is the first, but UCLA beat us to it. UC San Diego, UC Berkeley, NYU, University of Minnesota, University of Vermont, University of Missouri, Penn State, University of Virginia, Harvard University, Duke University, Brown University, Emory University, and even the University of Oxford, which takes us all the way back. So mindfulness is something that's here to stay at our top research universities in the United States and indeed around the world. And it is in this context that we envisioned and will launch Mindful USC. And I believe within the landscape of American higher education, even though there are many other initiatives that are similar, Mindful USC will be unique with its approach to three different and distinct areas: research, pedagogy, and practice. In terms of research, Mindful USC will highlight and showcase the interdisciplinary federal-funded research happening right here at the Keck School of Medicine on the science of mindfulness, especially in the Department of Preventative Medicine and the Institute for Integrative Health. So here on the website, you can see, well, let's see here. You'll see some research that's being that's highlighted and summarized that focuses on the work we're doing right here. Some examples include David Black's study that investigates the role that mindfulness practices play with sleep disorders, and also Randy Semple's research focusing on how mindfulness can increase and sustains one's attention span. And we're finding that students and patients at the Keck Center are really driving a lot of this. Students are demanding some kind of CAM, complementary alternative medicine training, in their medical school curriculum, and patients are also asking for those interventions, otherwise they'll take their business elsewhere. So in many ways, there are financial factors that are moving this forward. In terms of pedagogy, Mindful USC will explicitly engage with a new movement happening in American higher education called contemplative pedagogy. Over the last 2 years at USC, we've been pilot programming what contemplative pedagogy looks like. And through the Office of Religious Life and the Center for Excellence in Teaching, we've hosted a number of faculty workshops to support and promote the work of contemplative, reflective, and meditative techniques being used in a curricular context. Studies have shown that such approaches foster the development of the whole person, increasing capacities such as creativity, empathy, compassion, interpersonal skills, and self-awareness. That's really what a liberal arts education is about. That's what our USC mission statement talks about, the cultivation and development of the human mind and the human spirit. And we've been surprised by how interdisciplinary this faculty group has become. Of course, you expect folks in the social sciences and the humanities to think about contemplative pedagogy, but we've had professors showcase their work from physics, cinema, video game design, mathematics, and engineering. So it really is interdisciplinary. And what we've found is that meditation is no longer something you only try in your comparative religion course, but instead it's become embedded within the pedagogical fabric of this research university. And I look forward to Mindful USC serving as a leader in developing contemplative pedagogy resources and opportunities for our campus community. And the third component of Mindful USC is practice. Through this initiative, we'll be offering free 5-week mindfulness courses to faculty, students, and staff. And for the students here, we haven't launched this yet. This is the first time I'm showing this website, but if you want to go to mindful.usc.edu, you can sign up today before anyone gets the memo. Go to mindfulness classes, and you'll be able to see the different classes we're offering on multiple campuses. And if you're interested in this, because you're here bright and early and Sunday morning, you'll be able to sign up before anyone else. We'll have drop-in weekly meditation sessions on both campuses, instruction available in several residence halls. And we piloted these courses last year, and we're frankly overwhelmed by the response. For example, when we offered a 5-week mindfulness course at the Marshall School of Business, not for credits, not for a grade, and you can imagine how over-scheduled and extended our students are. To do something not for credit, not for grade, is it really means there's a genuine interest. When we opened up a course at the Marshall School of Business, we had 200 students sign up in 24 hours. And we had a similar response when we opened a course at the School of Cinematic Arts. 150 students signed up in the first 24 hours. We hosted a 9-week mindfulness course for faculty members and associate deans and directors. And afterwards, after 9 weeks, the faculty kept meeting on their own for another 4 weeks until the end of the semester. I mean, imagine how busy folks are, and for them to carve out space for this to do it on their own, I thought was an extraordinary proof of concept. So we believe that there is a tremendous thirst here for these types of courses, and I think the practice area is where we're a little bit different from other universities. Schools like UCLA offer mindfulness courses. They're 2 years. You have to pay a significant amount of money. They're really geared for people off campus to create a revenue generation opportunity to support the center. What we're doing is free courses, faculty, student, and staff, and we've boiled it down to 5 weeks, which is really a very difficult thing to do. We've worked with some folks at Insight LA who developed a 9-week course for the VA to focus on returning veterans, especially those who are suffering from PTSD and traumatic brain injury, and we've adapted it to a 5-week model focused really on a university community. For me as Dean of Religious Life, this initiative is the most ambitious thing I've ever tried to do at USC, because it truly is an interdisciplinary, multi-school, university-wide initiative geared at the entire university community, not something that's just student-centric. The key to its success, I believe, is to brand and promote it not as a spiritual or religious initiative, but rather one that is oriented around health and learning outcomes. At its core, it's a wellness initiative focused on stress reduction, workplace happiness, creativity, compassion, and wholeness. I think that's the best way to approach mindfulness on a secular research university campus. I've seen other initiatives at other campuses derailed because of their close affiliation with religious or spiritual life. But that being said, I believe there will be other benefits for our university community that go beyond just physical and mental wellness, that approach something called, I think, spiritual wellness. My hope is that this initiative allows folks to take some time and reflect upon the big questions in their life, the questions of meaning and purpose, the questions of significance, authenticity and identity, the questions that really make us human, the questions that my office, the Office of Religious Life, is oriented around. I think what's unique about my office is that we're one of the few, probably the only Office of Religious Life or university chaplain's office in the country that's not oriented around God. We're oriented around meaning and purpose and identity and significance, because those are the things, I think, that connect us all as human. Those are the spiritual aspirations that define us in many ways. And by focusing on those issues, I believe we can be a resource to an entire university community, not just those who self-identify as religious. That's why at our office we have a Jain and Buddhist group. Those are non-theistic traditions. And I'm really excited to announce this year that we brought on our first ever humanist chaplain, an atheist chaplain for our secular humanist group. It's only the 7th humanist chaplain in the country. So because we're operating in this model of looking for meaning and purpose, I think we can be very creative in how we approach it. I've been kind of excited and inspired by a new best-selling book called Excellent Sheep. Has anyone read this book? Check it out. It's a New York Times bestseller. It was written by a professor at Yale who makes a great case for the humanities. Those of you students who want to study the humanities, here's something I wish I could have told my parents when they were aghast that someone like me, who comes from a family with 11 physicians, would choose to get a Ph.D. in religion, which I'm not considered a doctor in my family. That degree doesn't quite count. They still pejoratively refer to me as Mr., even though my Ph.D. took much longer than any MD. But I wish I could have told them this, that humanities majors score higher than biology majors on the MCAT, they score higher than social science majors on the LSAT, and they score higher than business majors on the GMAT. It's incredible. Excellent Sheep offers a scathing critique of American higher education. According to the book's provocative argument, a liberal arts education has to stand for more than just a return on investment. In today's day and age, when a college education costs you upwards of $60,000 a year, the justification for a liberal arts education has really become, well, if you don't get this degree, you'll make less money, and if you do get this degree, you'll make more money, and the amount of money you'll make justifies the loans you'll take to get this degree. So in fact, the argument for a liberal arts education has become a return on investment, and students are clients, and professors are service providers, etc. But the promise of a liberal arts education is really to learn how to think, to learn how to be, to learn how to know one's own self. And what Excellent Sheep says is that we've created an environment where students are excellent sheep. They're excellent at jumping through hoops, the hoops that we put in front of them. They know how to jump through those hoops, but they don't know why they're jumping through those hoops. And it's that why that a liberal arts education should really be focused on. In 1971, 80% of freshmen said one of the most important things they wanted out of their undergraduate education was to develop a philosophy of living. Today, 45% of freshmen say that. I think most people look at education now as a pre-professional opportunity. So it's my hope that Mindful USC can help students think not just about the how to do X, Y, or Z, but the why. Why am I doing X, Y, and Z? I believe that's critically important on in an environment where we have many students in crisis. It used to be the case that you'd go into a university chaplain's office to talk about the big questions in your life, the questions of meaning and purpose. Who am I? What is my purpose? What is the nature of God? That's how I got to meet my university chaplain. But increasingly, the students who come into my office are in real crisis. They're suicidal, they're struggling with substance abuse, they've been sexually assaulted, they're alienated. Over the last 20 years, our number of counseling center visits at USC has doubled from 20,000 a year to over 40,000 a year. And this year, 1,500 students on American campuses will commit suicide. So I think that we are also dealing with a generation that is in some ways has real crises. And I believe that a Mindful USC initiative can help us think about these issues in an upstream capacity, not just in terms of the great upstream the upstream story is there are some friends, they're at a river, they see that there are these babies that are drowning, and so the friends go and try and get the babies out of the river, but one of their friends runs upstream, and they ask, what are you doing? Well, I'm going to see who's throwing these babies in the river. And I think we all need to be looking upstream instead of just addressing issues of student crises when they happen. And I think Mindful USC will give us the opportunity to at least think about that in a university-wide context. The goal of Mindful USC ultimately is to develop a culture of mindfulness right here on campus. But how does one change the culture of a large and complex organization like USC, an organization that is the largest private employer in Los Angeles with 3,000 professors and 42,000 students? I think it's the largest private school in the United States now, with 18 professional schools on multiple campuses, with more international students and religious groups than any other American campus. How do we change the culture? Well, in thinking about this, I've learned a lot from my time as the chair of the Mellon Mentoring Forum at USC. 8 years ago, USC received a significant grant from the Mellon Foundation to establish a mentoring program here at USC. And since the inception of the forum, we've created mentoring resources and leaders in virtually every school and department. We've created a highly competitive and prestigious group of mentoring awards that we give out to 20 faculty members each year in a formal ceremony. For those 20 awards last year, we had over 100 nominations and over 1,000 support letters. So you can see how invested our campus community has become in the Mellon Mentoring Forum. The success of the forum was based on faculty and staff investment and involvement in the process. Ultimately, I believe the culture of a university is disproportionately shaped by the faculty and the staff. Students come and go, but faculty and staff can stay at an institution for decades. So once the faculty and staff felt invested in the success and outcomes of the forum, over time our university developed a culture of mentoring that is now a national model. That's our hope with Mindful USC as well. Our goal is that each school and department faculty and staff member will create practice groups and drop-in opportunities for the people who teach and learn and grow there. That way we'll have multiple leaders and locations for the initiative. It will be decentralized, and it will be embedded into the fabric of university life. And that's ultimately, I believe, how you change a campus culture. That's why when the memo goes out this week, it will go out from the presidents of the Academic Senate, the Staff Assembly, the undergraduate student government, and the graduate student government. These are the representative bodies of the faculty, students, and staff. And you can see who our partners are and our steering committee, and you'll see how sort of diverse this group is, starting with the Office of the Provost, and really getting to many different schools, many different domains on campus. To do this in a grassroots, decentralized way, I think we really have to involve as many people and empower them to be leaders as possible. And I'm very excited to announce that the first event we're going to do is on campus, October 22nd. We're bringing Chade Mantang. He's the Chief Happiness Officer of Google for an event at 7 p.m. It's free and open to the public. We're going to formally launch our initiative with him. I'm really excited to welcome him to campus, and we're going to do a book talk and reception with him as well. And he's also agreed to join us for lunch that day, and we're going to do an event with our contemplative pedagogy group and our steering committee as well. So that'll be a faculty-oriented event. So that's Mindful USC, and I'm really excited that I had the opportunity to sort of talk about it for the first time. You guys are the first people to see the website. Students, like I said, if you're interested in this, you can sign up before anyone else. And maybe there's some questions or comments or observations, and yes, we'll start in the back. No. Yep. Yep, that's a good question. That's a great question. So the question is, who will teach these classes, and will we ever expand to create a certification program? We're really lucky that we have a professor here who's the co-chair of this initiative with me, and his name is Alan Weiss. These are all the steering committee people. And Alan is a 20-year meditation instructor at Insight LA. He's also a professor of internet marketing. So not only can you do the website, he can teach the classes like the perfect, it's like the Alan Weiss initiative. It really is perfect. And he is the one who beta tested our classes and developed them last year. So he's doing it with some folks at Insight. Really, we're doing this in a grassroots way. We don't have a lot of money to support everyone, so it's really people's compassion and generosity. He has grand visions. He wants to start doing classes on self-compassion, and his ultimate goal is to create a certification program for mindfulness teachers so that he can train faculty and staff around campus, and they can go to their departments and then train other people. That's how we plant the seed. But what I'm trying to do this year is do a year with this mindfulness program, establish it as something that's viable, and then go look for funding to really keep it going and expand it in the future. UCLA thought about the funding model on the front end. We're really thinking about this as a faculty, student, staff thing, so we haven't quite thought about how it will be funded moving forward. We're just trying to take advantage of the momentum and offer it as a resource internally, and we'll see where it goes from there. But I think what UCLA doesn't do as much of, but UC San Diego does, is also highlight the research opportunities which we have at USC for students to plug into federally funded mindfulness research, and the pedagogical aspects where the professor group that we have is over 50 professors who meet every month and talk about contemplative education. So that to me is a very exciting component as well. Yes, in the back. Oh, so.
Hi. Okay. I'm a counselor at the USC Counseling Center, and I do a lot of mindfulness with my clients. I work in the crisis team, and I often see people coming in crisis, and we end up doing mindfulness. Something I was wondering about for this website is oftentimes I'll do a mindfulness exercise with them, and they'll want something that they can do at home, 5 minutes if they don't have a lot of time. I do send them to UCLA's website because they have 3 minutes, 5 minutes, 10 minutes, different meditations and guided visualizations. Will we be able to have that as a resource on this website so that they can do that on their own if they aren't able to sign up for the 5-week course? Or
That's right, yeah. We will. We're going to develop video modules for people to do 3, 5 minute, 7-minute practices. We have another website that we're developing. We'll link this to that is more about practices that you can do, mindfulness practices you can do that people can read about it. We're fine if people check out UCLA, you know. This is not something that's, you know, like competitive yoga. We're not competitively mindful here. So I think we're all in it together ultimately, and you know, our orientation is a little different than UCLA in the sense that we're really focused on the campus community, but I hope we're able to share resources. You know, I always say in the Office of Religious Life, if we can bring together our Jewish, Christian, and Muslim brothers and sisters, we can bring together Trojans and Bruins on occasion. And so maybe Mindful USC will give us that opportunity. So yeah, I don't think we need to necessarily reinvent the wheel, but we do want some online resources for students to be able to go to, especially in terms of just quick practices they can do, even if it's purely utilitarian, like this is something you can do before finals, right? And just pitch it that way, because I think that's extremely beneficial as well. And we're super happy that Enjamin is a partner with us. We work with Paula, she's on our steering committee, and Andrew offers drop-in mindfulness classes. And if there's anything you are doing that, you know, around mindfulness, we want to put on the website. So really, I don't want to own and run this, and like I said, as the Dean of Religious Life, in some ways I'm trying to distance myself from it. But we want this brand and website to be an umbrella for anyone who's doing mindfulness. We want it to be a central place for people to go so they can find out everything that's happening around mindfulness on our campus. And so part of the initiative is really to just, in some ways, get people like yourself to say, hey, I'm doing this and I'm doing that, and we can sort of put it all up there without any individual or any campus entity being the sole owner or proprietor of it.
Thank you.
Yes. Yeah.
Okay, let me explain why we're doing this. Because we're videotaping everything. It'll be on YouTube. And if you're not using this, it's not going in there. There'll be blanks on the video. So please wait till you get that.
Thank you for this initiative. As someone who works on the health science campus and also teaches on that campus, how can I help bring these classes to that campus?
That's great. Thank you. So we're, you know, like I said, we're doing stuff on the health science campus. I think we have one class at with students, right? We're working on one more class at the health science campus. We should have one class offered at the health science campus. It's a 5-week course. We also have a drop-in class. Our big partner in this is the Institute of Integrative Health and Professor Mark Wiegensberg, and all the research that I know of is happening at Keck in one way or another, especially with David Black, who's the president of the American Mindfulness Research Association this year. So, you know, if you do something, we want to support it and promote it. That's kind of where we're at right now. We're encouraging people to develop, you know, practice groups or drop-in sessions. If there's a class you want to teach, I know when we presented this at the Institute for Integrative Health this summer, people were talking about, well, we have an art space that's like a place for mindfulness. So we're going to start on the website putting up places where people can go do reflective practices, chapels, et cetera, et cetera. So whatever you want to do and spearhead, we want to support and promote. What's happening there right now will be one 5-week class, one drop-in class. There is a complementary and alternative medicine student group there. There is a group that does a lot of yoga also there. So the pieces are slowly coming together on the health science campus. But our associate dean, who's also on our steering committee, is leading that initiative on the health science campus. And if you were to email me, for example, after this, I'll connect you with him, and he would love to meet with you and figure out what more we can do. It's vasoni@usc.edu. Thank you.
Hi, my name is Anna Chu,
Hey.
and I am not a USC person. Is there a venue for off-campus people to be involved?
All of our events will be open to the public. So our special events, for example, this semester we're bringing Chade Tang. Next semester we're bringing Pico Iyer to talk about his new book, The Art of Stillness. So all of those are free and open to the public events. I think our drop-in sessions will be free and open to the public, but our classes are really geared towards faculty, student, and staff. That being said, I believe you're from Orange County. I can connect with you on similar initiatives happening at, say, like Chapman University, which I believe would be open to the public and would allow you the opportunity to develop a mindfulness practice of your own. Okay, so we can be in conversation about that. Yeah.
Hi, thank you so much for doing this. My name's Donna, and I'm a graduate student in occupational therapy. And last year, partly as a response to hearing about the statistics of the mental health of the HSC campus, I decided to start a mindfulness meditation group. And that was last fall, and we've continued from the spring. And
Can you send us that information? Because we'd love to.
So now there are students in occupational therapy and working with occupational therapy faculty practice.
That's so great.
That are doing meditation groups kind of spontaneously. I'm leading one on Mondays at the HSC campus. It's open to students, faculty, staff. There's also another student who's doing sessions on Wednesday. And then there's also yoga being made available through OT students as well. So is that something that we send to you?
I think one of the things we're mindful of is not conflating mindfulness and yoga in this particular context. We really want to have this just be about mindfulness. There are other places where it would be appropriate to advertise the yoga stuff. So if you email me, I would love to get all of your mindfulness information up on the website, and then I can direct you to the right places where we could also promote what you're doing with yoga.
So if people are calling it mindful movement,
yeah, that's a good way to sort of think about it. Yeah, I think if you send me some stuff, we'll put it up in an appropriate way, and we'll drive people towards those practice groups too. And so that's essentially what this is. We have a decentralized campus. This is hopefully a centralizing resource, and that's exactly what our hope was, is that as we launch this, people would come out of the woodwork and say, hey, we're doing X, Y, and Z, and it's already happened in just our very first conversation, which is very promising.
I think we have time just for one more question. We're good?
As an undergraduate student, I'd first like to say thanks. And second, I'd like to say, aside from signing up with the classes, is there other ways I can get involved?
Yes, thank you.
Like on the research front, could I?
Yeah, you can just email us. I think there's an email address on the website, or you can email me directly, and I'll connect you with the researchers. But the other exciting thing is that we have a steering committee made up of faculty members who represent many different departments and disciplines and domains. Now what we're doing is we're going to create a committee of students who are interested in being mindful ambassadors. We want representatives of undergraduate and graduate student governments, and also people who are just like you, students interested in mindfulness and learning more about it, doing research, and promoting this initiative. So we'd love to tap you into that, sort of connect you with that group. That will sort of give you the opportunity to be a trained mindfulness leader on our campus. And that, to me, is one of the most exciting things about this, is the more we talk about, the more students want to be involved. And to have a student steering committee, I think, will ensure the long-term success of an initiative like this. So just connect with me, and we'll definitely follow up on all that.
Awesome. Thank you.
Thank you. So, just in closing, I want to say that I hope this initiative helps us think about the larger power and potential of mindfulness in higher education. What can mindfulness look like when it's on a secular research university campus that is made up of people from virtually every country in the world, every state in the country, every religion on the planet? to me, that's a very exciting development. It's one that we're seeing unfold in real time. And so my hope is that in a year or so, we'll be able to follow up on this conversation. I can tell you, what the challenges, the opportunities, the successes, the weaknesses of the program were, and how we're proceeding in the future. So thank you so much.